My name is Angela Schuffelman, and I'm a Community Program Manager at Avera Health, an integrated health system based in Sioux Falls, South Dakota, serving the upper Midwest through 6 regional centers with 300 locations in 100 different communities. As a health ministry rooted in the gospel, Avera's mission is to make a positive impact in the lives and health of persons and communities by providing quality services, guided by Christian values. Avera has deep roots in faith and service. With a continued emphasis on fostering an inclusive environment for employees, patients, and communities, work in diversity, equity, and inclusion happens in many ways throughout the Avera footprint every day. One of these important efforts is the Avera Community Health Resource Center located in Sioux Falls, South Dakota, in which I have the privilege and honor of managing. The Resource Center is staffed by community health workers that focus on immigrant and refugee populations. A little bit of background on community health workers. They really are trusted members of the community with lived experience. Our Avera CHWs navigate healthcare, help people apply for jobs at Avera, and connect to other community resources. We know that health is more than just seeing a doctor, so we help to make sure that folks have transportation and food and all the other things that they need to live a healthy life. Many of the community health workers are located in the clinic setting, but the Resource Center was an idea of Avera leadership wanting to meet the community where they actually are. The location of the center was intentional as it houses businesses that are often utilized by the immigrant and refugee populations. We've been here for a little over 6 months. And here are the community health workers that staff the Resource Center and a list of languages they speak. I think we're up to 15 now. Community health workers don't necessarily have to have healthcare backgrounds, but they're really trusted individuals with lived experience in the communities in which they serve. These incredible individuals have served as community health workers in their own communities for years and just now have a formal title. In addition to interpretation of language, our CHWs use their lived experience to really provide that cultural interpretation, which we'll share about in some client stories coming up later. In addition to meeting with our clients, our center serves as a trusted resource for community education and group learning. We invited the Avera Cancer Institute to educate on breast health, encourage mammograms, and discuss differences in tissue among persons of color and the importance of advocating for yourself as a patient. We also welcome the American Heart Association to teach us about racial disparities in heart disease, caring for ourselves holistically to improve heart health, and how to perform hands-only CPR. Avera recognizes that healthcare goes far beyond the hospitals or clinic walls, which is why community engagement is also such an important part of our work. Our CHWs are participating in community activities, serving on boards and committees, and even speaking at community events and on panels, all in an effort to educate the importance of cultural understanding. As the population we serve continue to see and experience our CHWs engaging in the community more and more, individuals are realizing that they also could have a different path. They're working with our CHWs to apply for jobs at Avera and realizing that production work that is often what the immigrant refugee population end up doing doesn't need to be where they stay. They're learning of other opportunities and options that they didn't even know were available. There is something special in this type of hope. Part of community engagement is also working to educate future healthcare providers about the cultural differences that they may experience in practice and why it's so important to be sensitive to the needs of the diverse population that they will be serving. We've welcomed a 4th-year medical student from the University of South Dakota, nursing students from South Dakota State University, and a Spanish class from the University of Sioux Falls to come and learn from our staff about their personal experiences and of those of the people that we serve. Avera's values are compassion, hospitality, and stewardship. What a better way to explain Avera's values than to share experiences of each through the eyes of the Avera Community Health Resource Center and those that we serve. Compassion, the first of Avera's values, is something that we witness at Avera every single day. At Avera, we express compassionate care through sensitive learning and responding, understanding, patience, and support. I can't think of an experience through the Resource Center that better demonstrates compassion than this story. One of our CHWs was recently contacted by a clinic about a child with several medical issues, one of them requiring tube feedings. Those tube feedings were generally provided by the school nurse. The child missed close to a month of school, and the last time the nurse administered the tube feeding, 3 cockroaches came crawling out of where the tube enters the body. As required, the nurse filed a CPS report, and the family had refused interpreters at Avera in the past due to lack of trust, really, in this tight-knit community. While we were very concerned that the family would refuse our services, our CHW met the family at a recent appointment with the provider. Not only did the family accept the help, our CHW was able to find out that the family's landlord was not taking care of the cockroaches after concerns were brought forward. So our CHW called and arranged for an exterminator to come and take care of the infestation, as well as follow up in the future. By exemplifying compassion in this interaction, not only was this child and family helped, but trust began to build with that entire community. Hospitality, the second of Avera's values, is expressed by means of welcoming presence and attentiveness to needs in a gracious manner. A man from our community of one of our CHWs had fallen in the snow and was unable to get up for some time, causing severe damage to the patient's leg. He was hospitalized at an Avera hospital, and eventually the care team made the difficult decision that the leg needed to be amputated in order to save the patient's life. Our CHW went to visit the patient while he was in the hospital, where the patient shared concerns about what happened when he would be released to home. Because of the established trust and shared lived experience as an immigrant, the patient asked our CHW for help to make sure that those things would be ready for him when he got home. So our CHW reached out to the social worker in the hospital, collaborated to get grab bars and other aids placed in the home, as well as a ramp to be able to get in and out of the home. As the man was discharged to his home, he continued to deal with phantom limb pain, which causes discomfort and pain in the limb that's no longer there. Some within his community did not understand this condition, leading to concern for the patient's mental health. So our CHW was able to share that this is actually very common in amputees and was able to educate the community about it, as well as help provide the patient with resources for support, as well as treatment options to help work through the pain. Stewardship, the third of Avera's values, is extremely important to our work to be able to be sustainable. Avera treats all resources with justice and responsibility. Our CHW received a referral from one of our clinics asking for help with a non-English speaking parents of a child that they were seeing. The young child had Down syndrome, and the care team felt that the parents didn't seem to understand the severity of the diagnosis, and in fact weren't even aware of the diagnosis until recently. There have been many missed appointments by this family due to lack of understanding and difficulty in finding transportation. Our CHW met with the family and provider appointment. After doing some research, found out that people in this culture believe that these types of conditions are actually caused by the use of birth control. This causes deep shame. So our CHW found out that this is why the family didn't take this condition seriously at first. This is one of the most powerful abilities of our CHWs, to not only interpret language, but also culture. Our CHW provided a comforting connection that allowed the provider to share importance of specialty care for this child and relieving that shame for those parents. She worked with the nurse from the care team to get the family signed up for FMLA because they had concerns about working opposite shifts and needing to get transportation to appointments. Initially, they were not able to qualify for Medicaid, but due to the condition, is now able to qualify, removing that cost barrier. Lastly, the family was not open to talking about accepting transportation assistance, as they didn't trust why Avera was offering to help with transportation. Often in the immigrant and refugee communities, healthcare is not always trusted, and they can feel like they're being tricked. But after our CHW explained that we are here to help and wanted to provide the best care for their child, they are open to that help as well. Stewardship was practiced throughout this entire interaction through respect, truth, and integrity, allowing this family's needs to be met, not only in the short term, but continuously. There are numerous stories that I could share about the important work being done by the CHWs at the Avera Community Health Resource Center, whether that is one of our CHWs being called to a patient's hospital bed after surgery, allowing a frightened patient to wake up to someone that speaks her language and can help her better understand aftercare. Or our CHW being able to walk with a patient that had no family support through a scary pregnancy with medical complications, even being able to be there at the birth of the baby. As our community's diversity continues to grow, Avera is taking important steps towards health equity, and the Avera Community Health Resource Center and our CHWs are really excited to be playing a part in the increasing access and meeting the needs of those that we serve. Thank you.